Module K2, Deep Breathing and Coughing Exercises. Deep breathing and coughing exercises are often done with or by paralyzed, weak, or post-surgical clients to decrease the possibility of respiratory complications. In this segment, the skill of assisting with deep breathing and coughing exercises will be demonstrated. Verify the doctor's and RN supervisor's order regarding the implementation, frequency, and ratio of deep breathing and coughing exercises. For purposes of the video, the ratio of deep breathing and coughing will be 2 to 1. Gather your equipment. A pillow is optional, disposable gloves are optional, tissue, and a sputum container. Explain the procedure to the client. Provide for the client's privacy, and assist him into a Fowler's or sitting position if possible to allow for maximum lung expansion. Place a pillow between the client's lower back and bed if necessary, or have the client sit forward in a chair. Place a pillow between the client's lower back and bed if necessary, or have the client sit forward in a chair. Instruct the client to place his hands or pillow on his abdomen, or place the palms of your hands on the client's ribs just above the costal margins. Instruct the client to take a slow, deep breath. Rapid breathing may cause dizziness, lightheadedness, weakness, fainting, etc. The abdomen should become larger during inspirations, thereby allowing the diaphragm to move downward so the lungs have room to expand. Encourage the client to hold the breath for about 3 seconds. Instruct the client to exhale slowly through pursed lips for at least as long as it took to inhale, so a maximum amount of carbon dioxide can be exhaled. Instruct the client to repeat this procedure 2 to 3 times as directed by the doctor's and RN's order. Have the client inhale slowly and deeply, and then give 1 or 2 deep coughs on exhalation, expelling air and secretions forcefully after moving his face away from you. Repeat if necessary as directed. Have the client dispose of secretions in a tissue or specimen container and place the tissues in the paper bag or garbage can. Note, if the healthcare aide will be handling the secretions, she must wear disposable gloves to maintain universal precautions. Note the color, odor, amount, consistency, and presence of blood in the sputum. Note if the secretions have increased. Note if the client is breathless, has difficulty breathing, or is in pain during deep breathing and coughing exercises. Wash your hands and open the privacy curtain. Finally, report and record observations appropriately. Incentive spirometer. Assist the client into a Fowler's or sitting position if possible to allow for maximum lung expansion. Hold the incentive spirometer in an upright position. Instruct the client to exhale completely. Place the mouthpiece so that his lips covered entirely, then inhale slowly and deeply, maintaining a constant flow through the unit. After the client has attained maximum inspiration, he should hold his breath for 2 to 3 seconds. Direct the client to remove the mouthpiece and exhale slowly. Instruct the client to relax and breathe normally for a period of time, then repeat the process as directed. Assess the client throughout the procedure for signs and symptoms of respiratory distress. Clean the mouthpiece as per agency policy and shake it dry. Change disposable mouthpieces every 24 hours. Completing both procedures. Because deep ventilation may loosen secretions, coughing can facilitate their removal. Have the client dispose of secretions in a tissue or specimen container and place tissues in the paper bag or garbage can. If the healthcare aide will be handling the secretions, she must wear disposable gloves to maintain standard precautions. Note the color, amount, odor, consistency, and presence of blood in the sputum. Note if the secretions have increased. Note if the client is breathless, has difficulty breathing, or is in pain during deep breathing and coughing exercises, or while using an incentive spirometer. Wash your hands. Open the privacy curtain. Report and record observations appropriately.